that's what really sparked my interest first was sort of the immune system. Because back when I started at university, there wasn't really much of a field called tumor immunology. But immunology obviously was there. And I think what fascinated me the most was the complexity of the system. And, that our body is actually a really nice place to live for a lot of bugs. Virus and bacteria, the body is a really nice place, moist and warm, very stable temperature and moisture all the time. And more than 1,000 bugs would love to live there if it wasn't for the immune system. And the immune system simply makes us sort of survive in that, despite having a really good living place for a lot of bugs, making sure that we can keep them out or keep them at bay. And at the same time, make sure not to, kill our own cells. And I think that's what sort of the balance of that and the complexity was what sort of really got me going and spurred the interest in immunology. And then later on came the interest in tumor immunology. Oh, that's a tough one. I think, maybe to take it in two different portions, so to say. I think we already have a lot of solid tumors where we have immunotherapies, checkpoint inhibitors typically, that actually work pretty well. And I think on that foundation, we can try to improve on that. So we'll get more patients responding and more patients with deep responses, so we get more cured patients. And I think one of the ways, which is already, being studied a lot, is combining with conventional treatments, chemotherapy, radiotherapy, but also with new checkpoint inhibitors. Last year, a new one, LAG-3, was approved. And I think that'll be along those lines that hopefully in time will improve response rates and depth to help a lot of patients and relatives. I think what is a little bit even more tricky, I think, are the cancers where we, as of yet, don't have any immunotherapies working. And that's actually a lot of those. I think maybe a little bit of optimism was thrown into that scene by the recent approval of a T-cell therapy in sarcoma, which I think actually goes to show that we can't see responses by cellular therapy in solid cancer. And hopefully that will, pave the way for more research into that area. And maybe even if we look a little bit further ahead, I think that the coming years we will see ways by which we can genetically modify the cells in vivo. So we don't have to harvest the cells, but can actually administer whatever agent that will address our T cells and make them sort of, the magic bullets that can attack cancer cells, also in the settings where we today don't really have any treatment. But, I might be all wrong. There might be something completely different coming in, and I just hope that it'll be faster than I hope. Yeah, well, it's been a long career. So, but I think some 10 years back, we started collaborating with a group that worked on exercise. And they had some data exercise. And that started us getting into exercise immunology, oncology. And what they had of data that we helped them sort of unravel the mechanism of was that when they put mice with tumors on running wheels, that elicited an immune response against those tumors that was actually, so exercising mice had much smaller tumors. And we unraveled the mechanism of that. And that was exciting finding, which has now been validated by a lot of other research groups in mouse models in particular, and also combinations with immunotherapy seem to be working better if you combine with exercise. And we have actually combined that in the clinical setting now with a randomized controlled trial in patients with lung cancer. And we are now eagerly sort of starting to look into those samples to see what happened in those patients that exercised 3 times a week in 6 weeks, concurrent with their immunotherapy. So, we can't wait to see the data of that. So, there's been a lot of exciting times, but there still is. I hope they will be more impactful than I have, but it's a tough question. I think because in any career, I think there's a lot of, when I look back, at least I can see I was also very lucky. I was at the right time, at the right place, and I mean, you can't really plan for that, can you? So I would actually say that today, if you want to engage in research into cancer immunology, there's a lot of research groups that are really at a very, very high level. And it's possible to work there as a student or PhD student and sort of get the hang of it. And I think even though you don't get the topic to work with that you dream about, there's so many different topics, exciting things to work with in this field. It has broadened out and it has become a big field. You'll even find that the big pharma industry is doing a lot of interesting stuff. So I think there's a lot of places to go to build your career to whatever level you would actually desire to go. Well, first of all, I think actually it's very timely to have a journal like Aging and Cancer Research and Treatment. I mean, first of all, we live longer, so a bigger proportion of us will be old. I mean, if you look in society 10 years ahead, there'll be many more old people. And the biggest risk factor for cancer is age. So we will see a lot of old people in the oncology clinics. And that poses a lot of issues, I think. First of all, they quite often receive treatment for other conditions as well. So you have to give them medication for their cancer, but they already are receiving medication for other indications. And as an immunologist, we also know that the immune system ages. And so that obviously may impact, good or bad. I think the jury is still out on that, on how the old patients respond to immunotherapy of their malignant disease. So I think this is really a very timely journal to arrive now, because there will be very important topics to explore a little bit with this topic that, when we started exercise oncology back in 2013 or something like that, it seemed like something that we were the only ones doing. We were not, but still, it has been expanded a lot since. And I think aging and cancer will also sort of gain a lot of wind in the years to come.
I think so.
And at least I think we should try and reach out to people who work with aging, because they will also see cancer patients one way or another. Maybe not for the malignant disease, but for the disease, and see if we can make that cross field grow.